So now I'm going to show you the insertion of an indwelling catheter on the female client. Okay, as you can see, I already have set up my sterile field and I've used the client's bed as my field. Okay, please just check out the videos on sterile field and sterile gloving for more information on how to set up your sterile field. Okay, so you can see that I've set out my trays. I have my Foley catheter in one tray and all the stuff I need to do the cleaning and preparation to insert the catheter in another tray. Again, all of this is sterile, as so are my gloves. Okay, so now I'm going to go ahead and prep my tray before I even start cleaning the client. So I'm going to be able to pull out all of these to clean, just to get ready, because once I designate a dirty hand to hold the labia in place, I won't be able to touch these items. So I want to make sure everything's in place. Okay. Most kits will come with a lubrication. A good thing to do is to put the lubrication onto the field itself, and you can squeeze it right into the field. Okay. So then your catheter is going to have a nice place to sit while you're waiting to insert it. You can go ahead and pull the catheter out of the bag. Just be careful not to pull it too fast or you're going to lose your sterile field. And you can set it right inside that lubrication until it's time to use the catheter. Okay. Next thing I'm going to do is I'm going to take my 10 mL of the saline solution or sterile water, whichever your kit comes with, and I'm going to go ahead and attach it to the port on the catheter itself. So when you're inserting the catheter, this is what's going to be used to inflate the balloon on the end. So you can actually see what's going to happen once I do place it in the side of the bladder. That's what's going to happen when we inflate the balloon. Okay. So I'm just going to have that ready to go. Okay. And now I'm ready to clean. So you're going to only use these things once for each cleaning. So for the female client, you're actually going to clean top to bottom. Okay? So now I'm going to designate my left hand, which is my non-dominant hand, as my dirty hand. So I'm going to pull back on the labia and make that area nice so I can see the urethra. And I'm going to take this and do one down. And I'm going to pop it back. You can see me putting it behind me because I don't want to go over my sterile field with that wipe. And you're going to do this from the urethra down to the anus and make sure it's very clean. So now you're still holding the labia in place, you have your catheter sitting in its lubrication, and you have your sterile water or sterile saline set up into the port. So now you're ready to insert. You're going to want to tell your patient to take a deep breath and that it will hurt a little bit and start inserting it into the urethra. So for the female client, it's important to keep inserting the catheter until you see urine. Okay. Once you see urine, you're going to insert it 2 to 3 inches more. Okay. So as a mannequin, we won't see urine here, but I'm going to pretend I saw urine and I inserted it 2 to 3 inches more. Okay. So now I'm in place. I'm going to insert my balloon. I'm going to use that full 10 mL of fluid. And the catheter is inserted. So now, most kits will come with a stabilization device. Some you might have to get separately, but there should be something that you can attach to that client's leg or thigh to hold this in place so it doesn't pull on the client. Then you'll take your urine bag and make sure it's hung down below the urethra with gravity. And that's how we insert the Foley. Now when I'm ready to remove it, all I have to do is take a sterile 10 mL syringe, attach it here, and that water that I inflated it with will come right back out. So you're going to pull that all the way back. And your catheter should flow right back out. Make sure again you have a good hold on it, so you don't want to make a mess, and you're ready to go. And that's it.